So we're in the Giving Children Hope office here with Barai, and I don't know your last name, and I probably can't say it. What's your last
You
name?
can, Katsande.
Katsande, and he is the Zimbabwe National Director for Global Aid Network, and here also with Scott Hendricks from GAIN, and they've come out to see, we're loading a shipment today to go to Zimbabwe, a container shipment. So they came out to see that and chat, and Farai, since you're all the way over here, why don't you tell us what's going on in the field office in Zimbabwe?
We are so grateful that God has given us the grace to be able to reach out our country with the gospel, and also to open up relationships with the government and the responsible authorities through the aid that we give in. We have been in the past been able to distribute some products that came from Giving Children Hope, which has helped a lot in our hospitals at a time when there was really scarcity in the hospitals. So the ministry is actually playing its part in reaching out to communities and to the villages, and also to the influencers in the country. But that's being necessitated by the help and the aid that we provide to the people.
So, Farai, why don't you tell me about the shipment that's leaving? I understand that you guys have a mobile medical clinic that'll be on its way, and this is going to be part of that. Why don't you tell me a little bit about what's going to happen to all this product?
This product will be used to support or to be used alongside our mobile medical clinic, which will be used to reach out to communities where they do not have access to a medical facility nearby. And some of it will also be passed on to clinics that we have been working with, local hospitals that we have been working with, like the Banket Hospital, which is a district referral hospital, and the Kotwa Hospital, which is also a referral hospital in another region.
And what are the healthcare needs in Zimbabwe right now? I know you guys had a big cholera outbreak. How's the country doing?
Well, we are thankful. We had cholera, but we are thankful that the situation has been arrested, and we don't have any new cases of cholera. But there is, since we've been going through a lot of economic challenges, there are still a lot of needs in terms of helping boost the medical aspect of the ministry, and drugs are a little bit scarce, and in most hospitals you may not be able to get the drugs. If you have them, it will be obviously expensive, because the government cannot subsidize on those drugs. So there is a great need for help in the medical area of the country.
And how many people can actually afford, if they go in to a hospital, to pay for the care?
Well, Zimbabwe is now 85% unemployment, and so if you like, you would say 15% of the population.
Oh, wow. Is your organization, is Life Ministry, doing anything in terms of helping in employment?
Yes, we have changed our focus of doing ministry in the past years. What we are kind of looking at is to bring in a holistic approach that addresses the spiritual and the physical needs of the people. Mm-hmm. And our ministry drive is to make sure that we also find ways of mobilizing and help train the youths on projects that are self-sustainable, so they can be able to run projects and create employment for themselves.
Mm-hmm.
So that's, in a small way, that's how we'll be able to help as a tool of bringing total transformation for the communities.
Yeah. Do you know what the life expectancy is?
Well, it's 47 years.
47 years.
Yeah.
Wow. And you guys are working in a lot of remote villages?
We do.
Or more urban centers?
We work across the country. Our work is both in the urban and in the rural areas. We have teams in 6 major parts of the country, and those teams oversees even the rural parts of their regions. So we cover the whole country.
Okay. And you always get asked a lot of questions of, how does this product, how does this help one or two people? And because I'm not all those places, never really have those stories. So can you tell me how one or two people that you're working with, because we help support you, and then how do you work in the community and help on a more individual level?
I think the most important thing is building or conscientizing the nation to say that the church is there to be able to help to meet the needs of the people.
Mm-hmm.
So whenever we go out into an area and we are giving out, for example, the medical supplies, then the community there knows that there is a group of people who is given this for no cost. So that alone is a very big message to the community to hear that somebody has just given some supplies to be used on them. So that becomes, that creates an environment that when you move into the area to share the love of Christ, people are ready and they are open to receive Christ because they have seen the practical love part of it.
Mm-hmm. You started with the physical needs.
Yeah.
And how long have you been working in life ministry?
Oh, for over 100 years.
He's a character, this one.
I've been with the life ministry since 2000.
Okay.
I left my job in 1999, and after sensing God's call in my life, and then we then joined in Campus Crusade in 2000. So for 9 years we've been with the organization.
Are you a pastor?
Yes, I am.
And you pastor one church, you're church planner?
Well, we do a lot of church planting.
Okay.
On Campus Crusade, at Campus Crusade level, but I also am a pastor of the local church,
Okay.
and which practices team leadership, and where a team of people give leadership, and my responsibility is to mentor those people giving the leadership to the church.